Diabetes is your body's not making enough insulin and your tissues aren't using the insulin that your body makes in an appropriate manner. There are essentially two types of diabetes, type 1 and type 2. Type 2 diabetes, 90 to 95% of the people with diabetes have type 2. There are a lot of environmental factors that contribute to developing type 2 diabetes. Obesity is the #1 factor. There is also some genetic component with that, and that's your body makes insulin, but it doesn't use it in the appropriate manner. Risk factors for type 2 diabetes are being overweight or obese, physical inactivity, poor diet, age is a big factor because your pancreatic cells wear out over time, and the stressors, the environmental stressors, make that more likely to happen and cause a bigger problem. Signs and symptoms of type 2 diabetes include thirst, incredible thirst. You urinate a lot, either decrease or increase in appetite. You may feel hungry all the time, difficulty losing weight, or just the opposite, you may be losing weight for no apparent reason. Fatigue is a big one with type 2 diabetes. There are 3 tests that you use to diagnose diabetes. The most common one is the hemoglobin A1C, and that one gives us an average of what your blood sugar has looked like over the last 3 months. Spot testing, there's the fasting blood glucose that requires you fast for 12 hours. You come in and get your basic screening panel done. Oftentimes type 2 diabetes, that's the start, is people come in for their annual labs. We see an elevated blood glucose and then we add the A1C to see where we're at for the last 3 months. The other one is an oral glucose tolerance test. We use that one frequently for pregnant women to diagnose gestational diabetes. So annual exam is very important, not just for type 2 diabetes, for your general well-being and screening. The recommendation from the Diabetic Association of America is that you start screening for diabetes at the age of 45, and then every 3 years thereafter if the initial test is negative. If there are risk factors, it's reasonable to start screening earlier. So uncontrolled diabetes affects every organ in your body. Complications include cardiovascular problems. You have increased risk for stroke. You have increased risk for developing chronic kidney disease. Neuropathy is a big one. Essentially, it damages the nerves as well as the blood vessels in every organ in your body. So in some cases, diabetes, type 2 diabetes, is preventable. Screening is very important, and that's where the annual exam comes in, and not only to screen for diabetes but also other problems that we can detect early and intervene when necessary and hopefully have better outcomes.